If you're over the age of 50, you could have your first vaccination by this time next month. Well, that's the government's plans right now as it opens another round of registrations very soon. Nicholas Crisp is the Health Ministry's Deputy Director General, and he's got the latest details of their vaccine rollout plan. Dr. Crisp, thank you so much. I know that you're very busy. Remind us what shots over 50s will be getting, please.
Hi, good morning, and good morning to the viewers. So the vaccines that we have available now in the country are the Pfizer vaccine, which is a 2-dose vaccine, and Johnson & Johnson, which is a single-dose vaccine. At this stage, the Johnson & Johnson vaccines, which we received on Thursday last week, are dedicated to the education sector program. And then, as the Minister announced this morning, a further 1.2 million doses arrived last night. And they are also designated for the completion of the education program and for the security cluster. The Pfizer vaccine is the vaccine that we are still using for the general population. But as soon as we establish the full pipeline of deliveries for both vaccines, then depending on the sites, one or the other will be available in the general public as well.
Are you managing to use all the vaccines that you're getting, or are they expiring due to a lack of over 60s coming in for their vaccinations?
No, we haven't been. Vaccines are not expiring. Certainly the Pfizer vaccine is not expiring. That has got a much longer lifespan, so that's not a risk for us at the moment. The vaccines move through the pipeline of deliveries over a 7-day period from the time they are released from the National Control Laboratory. So that's not a problem. The Johnson & Johnson vaccine that we have received is to replace the 2 million that were lost owing to the problems that with the manufacturing in the United States. And these vaccines expire on the 8th of August. And we will have used them all at the rate we are going by the 8th of August. So that's not a risk either.
Doctor, we've heard from doctors and nurses on the ground that things are really rough right now in Gauteng. Government spokespeople that we've spoken to have said that everything's under control and they are managing quite well. What's your take on it?
Yes, look, I think the one thing is about the vaccination program, the other is around the pandemic and the third wave. And our colleagues and workers in the hospitals are experiencing severe stress at the moment. And I think the public needs to understand that and support them as best possible. All the health facilities in Gauteng are under immense strain, and these are with workers who've been working non-stop now for the past 15 months or more, dealing with sick and dying people all the time. The vaccination program staff are also tired. They also work very long days and long weeks in the primary healthcare settings. But we are doing what we can to roll out as fast as possible. It is dire and it is extremely stressful for the staff on the ground.
You're sitting with the big decision makers on meetings several times daily. Do you think there are going to be harsher lockdown restrictions coming?
Well, fortunately for me, I'm working on the vaccination program, so I'm not party to that particular set of discussions. And I will not be in a position to comment on whether that's going to happen.
Okay. Well, do we have the logistics then to actually give 15 million vaccines in the time frame that we want to, I think, in the next 3 months?
Yeah, so what we mentioned in the program this morning where the Minister was answering questions is we have 3 major streams of activity. The first one is the general population, where we started with the 60-plussers and are now, as you heard, going to roll out to 50-plussers with registration from the 1st of July and starting to schedule them into the system by the 15th of July. So that's the plan for the general population. Then we have a number of services sectors, essential services sectors, including education, which should be over within the next 10 days, plus the police, the Defence Force, correctional services, and a number of others that will be dedicated services sector programs. And then the third major stream we have is the occupational health services, where we are targeting large factories, industries, and sectors of the productive population. These are all running at the same time. The public service is running we're not talking, the public health service, primary healthcare program is running the public program. The Department of Public Service and Administration, together with GEMS, is running the services sector program. And the workplace programs are being run by largely the private sector and the workplace programs. And then the private healthcare delivery sector is helping in all three of these.
Why not just open it up to everybody? Make sure that, for instance, here at ETV, eNCA, we could get private doctors to come in from Discovery, for instance, and vaccinate the entire staff's building. When do you think we could move closer to that kind of move?
Yeah, so I think it's quite dangerous to do that. If you just open to 40 million people all at the same time to go anywhere, how would we control what vaccine you're getting, where you're getting? If something went wrong, how would we account for it? And how would we account for who's going to pay for it if there weren't some kind of order as well? So there are many reasons why that would not be the solution. And having these multiple streams is definitely easier to make sure we are able to account for the vaccine. Nothing gets stolen. There's no black market for vaccines. And we are able to make sure we protect people with something that is genuinely a vaccine and not something that is, just labeled as such and might be anything.
All right, that was Dr. Nicholas Crisp, the Health Ministry's Deputy Director General. We appreciate your time this morning.